There are millions of Americans diagnosed with cancer each year, and the last thing they should have to worry about is having their life expectancy shortened because of where they live. Research shows that having access to state-of-the-art cancer centers has a significant impact on survival rates.
If you take a cancer like multiple myeloma, for example, this is a type of rare blood cancer. You compare the survival between being treated somewhere at a Mayo Clinic or a top center compared to your average community clinic. You see patients treated at that top center living on average 73% longer than the patient living in the community or rural setting.
That's Simone Jensen, founder and CEO of Radical Health. Medical knowledge is growing at a rapid pace, with a 2022 paper in Cancer Reports estimating that there is an average of 100,000 cancer-related articles published each year. That's a new study every 5 minutes. And while oncologists at top programs are more able to hyper-specialize, thousands of others have to cover and treat a wide range of cancers.
So, for example, you have to treat breast cancer and colorectal cancer and prostate cancer all at once. Versus if you look at these top centers, the clinicians tend to be very specialized in their unique area. Like they'll only focus on a subset of breast cancer. So there, let's say there's like a new update every single day, they're able to keep on top of that. But for a community oncologist, it's just incredibly difficult when so many things are being published every day to stay up to standard of care across all these types of cancer.
Which means some treatments and care strategies being prescribed are out of date or not as effective as newer options. But Jensen is working to change that with Radical Health. In an effort to give all patients access to top-tier care, Radical Health has trained AI models using the top cancer centers in America. She likens one of Radical's training methods to a cancer-specific form of ChatGPT.
That model has been trained to think exactly like a human doctor would. So it's read every single textbook, every single medical research article. It understands your unique cancer case and can compare it. So that's kind of our reasoning model. We call that like thinking like you're a top oncologist, and we get it to reason through the case step by step. But instead of just having limited context in your brain, we've read every single textbook, every single medical research paper.
For patients, getting an expert breakdown of their specific cancer and care plan is as simple as uploading their medical records onto Radical's platform.
We have the ability to link to 99% of all the providers in the country. So patients come to our website and type in the center they're treated at. So they may type in UCSF or the Mayo Clinic or a local hospital they're being treated at. Then on the back end, we're able to pull that data usually within 10 minutes or so. So then we have access to their entire medical records.
That data gets processed through the trained AI models, which are constantly monitoring the latest research and advancements. The final report is a personalized breakdown of the patient's diagnosis and treatment options.
We'll start by giving them an overview of their cancer, like what is unique about them, and then providing treatment options which could be relevant to them. So maybe they should go down this surgical route or down this immunotherapy route, and allow them to essentially be able to compare their options like they were being treated at a top center. And then we also provide information on the latest research, any clinical trials that would be relevant for them, and then the ability to refer them to those centers.
This information is possible through partnerships with top institutions like the Mayo Clinic and Johns Hopkins, which allow Radical access to millions of cases treated at these facilities.
And this really is the first time this data has ever been shared with anyone before. The Mayo Clinic would love to be able to provide every patient in the country to Mayo level care, MSK level care to every patient in the country. And they realize that the only way they can do that is if they work with an AI company like ourselves and give us their data, and then we can train an AI model which essentially acts like their top doctors. And then because we're software, it's scalable to every patient in the country.
It's important to know that Radical is HIPAA and SOC 2 compliant. Personal health data is securely stored and can be deleted at the patient's request. Jensen says one of the best parts about having access to real cases from these top institutions is that Radical can find one that's most similar to the user and compare the data.
So let's say a stage 4 colorectal cancer patient comes to us. We can look at their medical record, and then we can go to this huge data set we have, and we can be like, oh, we found that for similar patients at these top centers, drug A is better than drug B because we can see you look very similar to that patient in like a genetic and radiology perspective. So it's both combining all the research ever published online and then also being able to go deeper and then actually personalize care by being able to find out, like, have there been any patients in the past exactly like you and what worked really well for them, and fully individualizing care there.
There's a section included at the bottom of these patient reports that walks users through what questions they should ask their oncologist, which really allows the patients to be an active, educated member of their care team.
Some patients really want a surgery, some patients don't want a surgery, and we essentially provide patients with all the options to be able to make the most informed decision for both themselves and the family as well. So we have a couple of exciting cases where patients were able to actually influence their care journey based on what they actually wanted themselves versus just what was standard of care in healthcare.
And while Radical's reports can help increase advocacy, for some patients, it serves as a confirmation that they're on the right treatment path. Elisabeth Drabkin discovered Radical after her first cancer diagnosis had been successfully treated. As an active, healthy woman in her 30s, Drabkin was shocked to discover that she had adrenocortical carcinoma. It's a rare and aggressive cancer that forms on the adrenal glands.
I had a very, very large tumor. It was about the size of a grapefruit sitting on my left adrenal gland and abutting some other organs. And so the decision was made, and I really didn't even ask questions because we were, again, just grappling with a very unexpected diagnosis. And so when the Hopkins team said, we're doing a surgery, we did a surgery. And so I did go in that July of 2020. I was unable to have anybody go with me. My husband had to tell me goodbye, give me a kiss in a kind of pre-waiting room area. And I didn't see him for almost 2 weeks.
Thankfully, the surgery was successful. Her doctors expected a reoccurrence within the year, but Drabkin remained cancer-free. That is, until 2024. Nearly 4 years after her surgery, tumors were found in and around her lungs. This was when Jensen came across Drabkin's LinkedIn profile and invited her to try Radical.
Candidly, I was a little skeptical. I, at that point, had reached the kind of mythologized 5-year survival rate. And so in this short but long time, I've seen a few startups, things that promise a lot of things in the cancer care world, but I gave Radical a try.
Since 2020, Drabkin has had a large care team at a top-tier cancer center. Radical's report was able to confirm she was on the right path, but a newer tool in the system offered something that could be a bit harder to find: hope. Alice is Radical's newest AI companion that gives users a more interactive experience.
Patients really wanted to be able to talk to us both on like a daily or like an hourly basis if they have questions on their report. So Alice works in a pretty simple way. You link your phone number. You can also access it on the Radical platform, and she'll essentially text you and ask you how you're feeling every day, and is there to support both on like symptom management, like, oh, I'm feeling nauseous, is there any medication I can take? Like, oh, I'm dehydrated, what should I do? But also just to be there for you in a more like holistic way. Obviously, cancer is such a vulnerable experience both for the patient and their family, and we want to be there to support throughout that period. Obviously, being able to provide everyone with like the top treatment is like a big part of it, like that peace of mind that you're on the right care. But there is also so much we can do in between, from like supporting with like family members to how should I tell my children about my cancer, to what should I be eating, how should I be sleeping.
Drabkin turned to Alice when her doctors had run out of answers.
So I'm currently undergoing a treatment called PEF, Pulsed Electrical Field Treatment Therapy. It's been FDA cleared for a little while, FDA approved for, I think, about a year and a half. It was initially developed for non-small cell lung cancer. My care team at both Hopkins and NYU has been unable to determine if any other adrenal patients have used this treatment, and if so, what the success rate was for it. I recently thought that I might break Alice, essentially, by asking her about the use of PEF in adrenal cancer patients.
But to Drabkin's surprise, Alice was able to describe the instances of adrenal patients using PEF and the high success rates this population experienced.
To know that there is a high success rate, even it seems like with adrenal patients, when physicians at world-class institutions could not answer that question with confidence, and Alice could. That to me was a clarion moment, and it almost brought me to tears. I was just staggered, and it gave me the confidence to know that we were pursuing what seems to be the correct treatment for me.
Drabkin is still undergoing PEF treatment and is now a member of Radical's Patient Advisory Board. Jensen says Radical's goal is to have patients at the center of everything they do, and the advisory board helps keep patients involved in how each product is built.
So we have a team of 40 patient advisors who work with us to make sure the way we present information is both easy to understand, but also empathetic while still being informative and allowing them to fully advocate for their care. So we really work with them, and they've been so instrumental in essentially building that patient-facing side with us.
One example of this impact is the reading level of each report. Healthcare is complex, and cutting-edge research often includes words many of us would have to look up the definitions for. So to make sure that each patient can understand their file, Jensen says all reports are set at a 6th grade reading level.
And we find that that level is also enough to be able to communicate all the scientific complexities. We also try to communicate it in quite a visually appealing way, and then we group it into different sections. So we don't assume that you know everything about your cancer to begin with. We start by going into the basics of what actually is stage 1 breast cancer? What does stage 1 mean? What does this ER-positive genetic test mean before we dive into the complex treatment options? So we both work with patients who have gone through the process, and then also communicate the words in a simple way, and then have the structure of we don't assume you know anything before. We want to be able to be inclusive to all patients, whether they're just being diagnosed or also later stage as well.
The reports are verified by other AI systems as well as humans before they reach the patient.
So far, we actually haven't had the humans make any changes, but I think it's helpful to have that human in the loop still, because it's also nice for patients to be able to talk to a human who has context on their case. So once we publish this report, they get on a call with our team, our nursing support team, who's able to walk them through it, explain what it means, because although we believe that AI is able to, in theory, provide better recommendations, it's always nice to have that human face-to-face interaction.
You can find more information about Radical Health, Simone, Jensen, Elisabeth Drabkin, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our executive producer is Amira Zaveri. I'm Elisabeth Westfield.
Coming up, resources that...
Each week on the Viewpoints Radio podcast, you'll hear from our leading experts on an important topic within education, history, society, psychology, and more.
As one researcher puts it, nobody waves, but everyone waves back. Once you do offer that initiation and that opportunity, people are more willing to connect with you than you think.
Viewpoints Radio podcast is produced by our team of award-winning journalists. Subscribe today by searching Viewpoints Radio wherever you listen to podcasts.